Let's return to the state of COVID-19 in our state. Hospitalizations ticked up slightly today by 8 patients, up to 472. We're still down almost 50 patients from where we were this time last week. 9.9% of Coloradans, 570-some people, have received their first dose of the vaccine. Of that 9.9%, you got that smaller piece of the pie, 4.2%. Those are the people who have both doses. It's been 3 days now since the state opened the door to a larger group of people now eligible to get the vaccine. As of Monday, people 65 plus and those who work in schools are eligible. Of course, we caution, just because you're eligible does not mean that you can expect to get an appointment and the vaccine anytime soon. Our Steve Sager talked to one small hospital system that decided they're actually going to formalize holding off a bit, Steve, to continue working on vaccinating the higher-risk 70-plus population.
Yeah, and Kyle, there are a few hospital systems across the state and vaccine providers who are doing this, essentially saying to the 65 and up community, hold on for a little bit until we get into a comfortable place with those 70 and up. The state has told providers that they still should prioritize those 70 up. Let's start all of this with a conversation of where we stand county by county in the metro area. Denver County is halfway there, 50.5%. The Tri-County Health Department, Adams, Arapahoe, and Douglas counties, they're at 48.6%. Boulder's at 60%. Jeffco 52.7%. Broomfield 43.8%. And Larimer County 54.3%. So as you can see, Boulder leads vaccination rates in people 70 plus. There are about 30,000 of them in Boulder County. This weekend, Boulder Community Health sent out an email to patients letting them know that they would not be starting the process of vaccinating people in that 65 to 69 range just yet. Said that they had too many people left in that 70 plus population yet to vaccinate. So the CEO, Dr. Robert Vissers, told me the decision had everything to do with vaccine supply and not wanting to guess when they might have enough.
We could have opened it up now, except for that we just would have been scheduling you 3 weeks in the future with less certainty that we had a vaccine for you. So it's for us, it's working well to go week to week. We are a smaller system dealing with a generally smaller population. So we have that luxury and flexibility. Like I said, so far, we've not had to cancel a clinic.
So the good news here, he now says that people 65 and up will be able to start at Boulder Community Health next week. He says right now his system's doing about 700 to 800 vaccines a day. They could double that and do a whole lot more if they had more supply of the vaccine. The state's goal is to have 70% of people in that 70 plus population vaccinated by the end of February. And today, Scott Bookman told reporters that he's the incident commander for CDPHE. He told reporters they're about 73% of the way there, almost halfway through vaccinating all people 70 up in Colorado.
Sticking to the plan. Pretty logical.